Hello, and welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for May 20th, 2026. Thank you for joining us today, and thank you to the current Osteoarthritis Action Alliance sponsors shown here who help support our work, which includes the Lunch and Learn webinar series. We are excited to have you join us for today's presentation during Arthritis Awareness Month. Now it is my pleasure to introduce three of today's speakers, Kirsten Ambrose, Katie Huffman, and Serena Weisner. The other three speakers will be introduced before their sections of the presentation. Kirsten Ambrose is the Associate Director for the Osteoarthritis Action Alliance at the UNC Thurston Arthritis Research Center. She has a Master's of Science in Exercise Science and more than 20 years of experience managing multidisciplinary teams toward successful research conduct and public health action. Katie Huffman is Director of Education and Outreach for the Osteoarthritis Action Alliance and Research Project Manager in the Thurston Arthritis Research Center. Katie has a master's degree in gerontology, and for the OAAA, she coordinates the development of educational resources for patients, healthcare providers, and employers. Serena Weisner is the Director of Community Programming for the OA Action Alliance. Serena is a gerontologist who oversees OAA's efforts to disseminate the Walk with Ease program and works closely with community-based organizations, helping them implement arthritis-appropriate evidence-based interventions. The title of today's presentations is AAEBI Standards and Recognition. What's new? Kirsten, I will turn it over to you.
Okay, thank you, Lee. I will lead us off today to share a bit of history about the AAEBI review process and programs, and for context with the new standards. So starting in 1999, the CDC Arthritis Program initiated an earnest effort to improve the lives of people with arthritis. They did so in part by funding state health departments to disseminate evidence-based programs for physical activity and self-management education, initially called lifestyle management programs for arthritis, or what we now call AAEBIs. The reference listed on this slide describes the history and rigorous review process the CDC undertook to evaluate and ultimately recognize these lifestyle management programs, which included 5 physical activity programs, 2 self-management education programs, and several promising programs that did not quite meet the rigorous review criteria, but were on their way or were certainly ones to watch. That program list stood for quite a few years before the CDC funded the Osteoarthritis Action Alliance to conduct a new AAEBI review in late 2020, and we pretty well adhered to that original review process that's described in the reference. So arthritis-appropriate evidence-based interventions are programs proven to improve arthritis symptoms, such as pain or limitations in function. The purpose of the review process is to identify new programs that meet criteria established for arthritis-appropriate evidence-based interventions. And the overall goal really is to expand the menu of AAEBIs. We want to reach different populations, including people speaking different languages or in different cultures. We want to address different arthritis risk factors with these programs, and we also want to offer a variety of delivery formats, essentially meeting people where they are with more offerings for beneficial programs. Okay, so these are the programs that we're talking about. On this slide, they are listed alphabetically, but for purposes of today's presentation, I'm filling in the list by the year that they were recognized, just for illustration. So these are the 7 original physical activity and self-management education programs that CDC recognized under that review process I talked about on the reference on the previous slide. In 2021, when the OA Action Alliance took over the review process, we were able to elevate those programs that were on the promising program list for some time, but now met criteria. We also added several new programs, bringing us to a total of 18 programs. In 2022, we added 4 more programs, 2 of each type. In 23, we added 2 more physical activity programs. And then jumping to 2025, we expanded the Walk with Ease offerings with several program delivery adaptations. And in a few minutes, you'll hear Serena talk about the adaptations to existing programs more broadly. And then later on, our guest speakers will tell you about each specific Walk with These adaptation. But for now, this is our current list of 27 programs. And it looks like a lot, but even with all of these programs, delivery across the country is still quite limited. This brings us to today, where we are introducing AAEBI standards. The idea of standards germinated with the CDC as they began exploring ways to expand program offerings before handing over the formal AAEBI review process to the OA Action Alliance in 2020. And remember, there were only 7 programs at that time, but even as we recognized more programs, we continued to float this idea of a broader standards to allow for programs that may not meet the rigor of AAEBI recognition, may never meet the rigor of those criteria, but these are programs that are still safe and beneficial for people with arthritis. So in 2024, the OA Action Alliance convened a task group of field experts and several CDC arthritis program officers to evaluate the AAEBI review process and consider opportunities for recognizing a broader selection of programs. And I will turn it to Katie to tell us a little bit more about the standards.
Thank you, Kirsten. From the work and recommendations of this task group and with input from the CDC Arthritis Program, the OA Action Alliance team came back together and developed comprehensive standards for ABIs, clarified the definition of an ABI and the criteria used to evaluate programs, refined a tiered recognition system, and updated the review process. Before we get into the specifics of the ABI standards, what are standards? The task group and staff teams spent a lot of time talking about what standards are and what their purpose is. Standards ensure that recognized programs have solid research demonstrating they are appropriate, beneficial, and safe for adults with arthritis and can feasibly be implemented for broader use. Standards define the criteria used to evaluate a program for recognition as an ABI or other tier designation. If you think about it, a standard is the goal or benchmark, while criteria refer to the specific, actionable, or measurable steps used to reach that goal or benchmark and can be used for program development or evaluation. The standards provide clear, transparent criteria that serve a few purposes. They can guide program developers in meeting ABI requirements. They can help community organizations identify programs to offer, and they can support adults with arthritis in choosing beneficial programs or classes. In talking about standards for ABIs, the task group recommended clearly defining what an arthritis-appropriate evidence-based intervention is so that organizations or developers would know what types of programs might be eligible. The updated definition now describes ABIs as programs offered by community-based, healthcare, or national entities that deliver structured content and facilitate behaviors or education that help improve health and quality of life for adults with arthritis, are proven to improve arthritis symptoms, target at least one of the following focus areas: physical activity, weight management, self-management education, joint injury, or falls prevention. They may be delivered in person, virtually, by telephone or mail, self-directed, or a hybrid of these formats. And they can be tailored to individual participants, but are implemented as programs or classes intended for broader use, not solely for clinical treatment. And now we'll get into the new ABI standards. Now, these are not going to be unfamiliar to you if you already know about ABIs. They are in line with the former ABI review process, but they're clarified and hopefully a bit more transparent. For a program to be recognized as an ABI, there are 5 standards, all of which must be met. The program must be arthritis appropriate, have infrastructure and quality control in place, have protocols to ensure safety of participants, have evidence to show it helps arthritis, and have the potential to be adopted by other organizations or individuals. And now I'm just going to talk about each standard and the criteria within each. Standard 1, program is arthritis appropriate. even though there are only 3 criteria, this is going to take me the longest to go through just because there are multiple layers to these criteria. First, the program must improve at least 2 arthritis-specific outcomes or skills. And these include outcomes such as pain, stiffness, fatigue, function, health status, quality of life, or behaviors that improve arthritis outcomes like physical activity, weight management, and finally, skills that improve arthritis outcomes like joint protection, balance, or stress management. So the second criteria in this standard is that the program should align with the latest OA management guidelines. Now, the outcome or skill addressed in the program may not be explicitly discussed in the guidelines. For example, stress management is not named in the guidelines, but self-management education is, and stress reduction or stress management could be a part of that type of curriculum. So there's a little latitude there for that reviewers will allow. And lastly, the program should target one of these focus areas: physical activity, weight management, self-management education, or joint injury or falls prevention. And this is an area of change where we really do want to expand beyond the current offering of physical activity and self-management education programs. So with these 4 focus areas, the program may fall into more than one of these categories, but it has to meet the specific criteria that I'll mention on the next slide for a primary focus area that program gets to choose during the application process. As an example, the Arthritis Foundation's Walk with Ease, which is already a recognized AAEBI, if that were the program going through the review process, they might say, well, we know this program is a self-management program as well as physical activity, but we're going to choose that as we go through this process where our primary focus area is going to be physical activity. So with that in mind, as a physical activity program, as the primary focus area, they will need to meet these criteria as well. Align with the physical activity guidelines for Americans, include one or more physical activity element, be low impact and non-contact, allow participants to have control over that activity, intensity, frequency, and duration, and make exercise modifications available for to accommodate different activity levels or physical abilities. Self-management education programs should be based on behavior change theory and should foster skills important in managing arthritis, such as self-efficacy or goal setting. Joint injury or falls prevention programs should be multi-pronged here. They need to incorporate a specific activity and foster skills and knowledge. So the activity might be strength training or balance or even training on use of assistive devices, but there also needs to be an education or skills development component. For weight management programs, these need to approach weight management from behavior change perspective. They need to incorporate lifestyle changes to help with safe weight management. And they need to support personalized strategies, not only for weight loss, but also for weight maintenance and prevention of weight regain. The second standard, infrastructure and quality control. Within this standard, the first criteria is that the program should make guidance materials available for an organization to implement the program or to enable individuals to take the class or program on their own. The curriculum should include interactive or engagement components beyond just print or website information, verbal instructions, or clinical care. The program should have a method for data collection, whether that's pre and post program assessments or even program delivery metrics. And there should be engagement strategies to reduce participant dropouts. Standard 3, safety, is pretty straightforward, just one criterion. There should be protocols in place to manage safety and adverse events among participants. In a group or in-person class or program, this is an example would be having a CPR certified leader or other certification as the class content requires. For virtual or self-directed, classes, just as long as there is safety built into the curriculum, such as including pain warning signs or guidance to the participant for when to contact a healthcare provider. Standard 4, the program should have evidence to support that the program is beneficial for individuals with arthritis. There's really no change to this from the previous review process, but we do have some clarifications here. The program research still has to have been published in a peer-reviewed journal article. The primary study needs to have analyzed at least 75 or more individuals in their intervention group. There needs to be pre and post program data, and the post program data should be at least 3 months post program. The research needs to measure at least 2 arthritis specific outcomes or skills, and there need to be statistically significant changes in at least 2 of those outcomes or skills. The research should include people with arthritis, and there should be consistency of evidence across studies demonstrating the improvements in those outcomes or skills. And the studies should have reasonable rigor. Standard 5, this was not necessarily described in the criteria as part of the former review process, but it was used by reviewers. So we're just codifying this in this 5th standard. The program can be adopted by other organizations or individuals. The first criteria here is that the program has already been implemented in one or more community sites. So it might have gone through the research in a controlled research setting, but subsequently it has also been implemented in a community setting. Second criteria is that the program maintains adoption products that are available to the public. This could be providing leader trainings or technical assistance to adopting organizations or even marketing materials. And the third criteria is that implementation costs, whether that's for the organization or for an individual, need to be clearly defined. Now I'm going to pass it over to Serena, who's going to talk about the new application process and tier designations.
Great, thanks, Katie. And before I dive into the program review process, I do want to note that those programs that are already designated as ABIs do not have to be re-reviewed at this time. So if you are one of those program administrators or developers and are wondering about that, you can breathe a sigh of relief right now. So I'm going to go ahead and start with step 1, the letter of intent or the LOI. If you are a program developer or administrator, you'll begin by submitting a brief LOI via an online survey. So think of this as an initial screening tool that helps us assess if your program's eligibility and readiness for a full ABI review. So you'll be asked to share contact information, a very brief overview of the program, the focus area, PubMed links for your peer-reviewed publications, etc. You'll also be asked to ensure that your program checks all the boxes for an ABI that Katie reviewed earlier, and a Word version of the LOI questions is available via a link on the LOI survey. LOIs can be submitted on a rolling basis whenever you're ready, and once submitted, please allow about 2 to 3 weeks for our team to review it and get back to you. Also, a quick note, if your program happens to be an adaptation of an existing ABI, there is a place on the LOI where you can indicate this, and we have a modified and streamlined ABI application for those circumstances. So once we've reviewed your LOI, there are a few potential paths forward. Programs that appear fully eligible will be formally invited to submit a full ABI application or the modified application for program adaptations. Please keep in mind that an invitation to apply does not automatically guarantee official recognition, but it is your gateway to the next step. If your program isn't quite there yet, but still offers great value, it may be offered an alternative designation, such as promising program or arthritis friendly program. And I'll go over each of those in a few minutes. If you're invited to submit an AABI application, this will also be completed in an online survey format similar to the LOI. Also similar to the LOI, we will provide a link to a Word version so that you can complete the application offline and then copy and paste the details into the survey. The application is quite comprehensive, so please anticipate some time in completing it. You'll be asked for more details about the program model, target audience, delivery mode or modes, outcomes, alignment with ACR recommendations, quality control, etc. Once a program has submitted the formal AABI application, the OA Action Alliance team will review it thoroughly. If there's any conflict of interest among our team or any questions that we may have, we will enlist a panel of experts in the field to provide additional review. We anticipate a maximum of about 8 weeks for a review of AABI applications and for a decision to be made. So let's go ahead now and move into the 3-tier designations. The first one, of course, is the AABI, the top tier. And to achieve this status, a program must meet every single standard and related criteria described by Katie earlier. Program admins must formally apply for the AABI recognition, so they must complete that full AABI application. And historically, those who have been designated as AABIs can utilize CDC arthritis funding for implementation. And we encourage organizations who have been designated as AABIs to display the seal that you can see here in the right-hand corner of the slide on websites or other marketing materials to highlight this accomplishment. Our second tier is promising program designation. These programs successfully meet the core standards for being arthritis appropriate and ensuring safety, participant safety, but they're currently lacking in one or more of the other AABI standards. So typically we see that the areas that are missed are the rigorous research data or not having been implemented in a broader community setting outside of a research environment. For this designation, program admins must complete a minimum of the letter of intent, and some may even complete the AABI application in order to be considered a promising program. Programs can remain on the promising program list indefinitely, even if they have no intention to seek full AABI recognition. Program admins who are in charge of the promising programs should definitely consider using this seal, again, in the upper right, on websites and marketing materials. And the final tier is the arthritis-friendly program. We know that there are many fantastic programs out there that benefit their participants, and they're completely safe for adults with arthritis, but they simply don't have the extensive evidence or infrastructure necessary to be recognized as an AABI. For this tier, program admins do not need to apply or submit a letter of intent for formal recognition. Instead, we have provided an arthritis-friendly checklist that I'll share on the next slide that will be your guide in determining if a program is arthritis-friendly. Program administrators are highly encouraged to feature the arthritis-friendly seal on their websites and materials, again, as shown in the upper right of this slide. And just an additional note about the seals that we have provided, we really do highly encourage you to use them. The more visibility we can give these recognitions, the more people will seek them out and the more weight they will hold for organizations looking to adopt new programs. So next, let's just take a brief look at the arthritis-friendly programs checklist. I do want to mention that this is can be accessed by scanning the QR code in the upper right corner. It's also available on our AAEBI website. Our goal for this checklist is really twofold. First, we'd love adults to actually use this checklist themselves as program participants to see if their favorite local program is safe, or maybe to help them actually choose a new program to attend. And then secondly, we want organizations to use this as a self-assessment tool to see if their program can be labeled as arthritis friendly. So please feel free to check out this checklist and see if your program can currently be designated as arthritis friendly. This is something that you certainly could add to any marketing materials as a precursor before going through the letter of intent and AAEBI application. And this is just a reminder of the information shared by Katie earlier about the different focus areas and what to consider when using that checklist. And now I'll go ahead and turn it back over to Kirsten.
Excellent. Thank you so much, Serena. So, you've just heard both Serena and me refer to our newest ABBYs, which are adaptations to the Walk with Ease program. So, let's get into those. We will start with the self-directed enhanced Walk with Ease program, and I will introduce our next speaker. Nick Turkas is the Senior Director of Patient Education and Community Connections for the Arthritis Foundation, a national nonprofit specializing in turning evidence-based health initiatives like Walk with Ease into impactful, community-driven programs. So, Nick, please tell us about the Self-Directed Enhanced program.
Excellent. Thank you. It's my pleasure to share a little bit more about Walk with Ease, Self-Directed Enhanced. At its core, Walk with Ease is an evidence-based program that helps individuals with arthritis and chronic pain safely increase physical activity through walking. The self-directed enhanced version combines independence with structured support, making it both flexible and highly scalable. One of the biggest strengths of this model is centralized coordination. Participants enroll and move through the program together in a defined cohort, starting and finishing at the same time over 6 weeks. Even without required in-person sessions, this structure creates shared milestones that build commitment and momentum. Participants know they're in a group moving through the same journey, which may improve engagement and completion. That said, this model is flexible. Participants can schedule walks at a time that is convenient for them. And importantly, this model is not just effective, it's cost efficient. It reduces staff time and facility needs. Each cohort can accommodate far more participants than would be safe using the group model. Facilitators are encouraged but not required to be certified leaders, which lowers barriers to implementation while still maintaining program integrity. The experience is reinforced through intentional communication loops using email, text, social media, or phone calls, either automated or manual. Participants receive regular encouragement, reminders, and tips to keep them motivated and on track. Organizations can offer optional in-person group walks to build connection and community while still maintaining the accessibility of a self-directed program. Another key strength of the program is a robust set of participant and facilitator resources. Each participant receives the Walk with Ease guidebook or audiobook, which includes self-assessments and safety guidance, structured walking progression plan, tools like walking diaries, self-tests, and time and distance checks, intensity monitoring strategies, and a personal commitment contract. These tools empower individuals to confidently manage their activity and progress. Individuals are supported through a comprehensive implementation toolkit, including sample emails and communication templates, video resources that reinforce learning, and an accessibility guide for inclusive delivery. It's important to note that these materials are both available in Spanish and English. In short, the Walk with Ease Self-Directed Enhanced brings together scale, flexibility, support, and affordability, making it a powerful way to improve health outcomes in the communities we serve. Thank you.
Great. Thank you so much, Nick. Now we will turn back to Serena to tell us about the Osteoarthritis Action Alliance's online delivery system for Walk with Ease.
Thanks so much, Kirsten. So the OA Action Alliance's Walk with Ease portal is an online delivery system that supports and automates tasks related to the dissemination of the self-directed Walk with Ease program or the self-directed enhanced program. It's particularly helpful for those organizations that may have a broad geographic area that they're covering. That was kind of our initial intent because we at the OA Action Alliance are a national organization and we were trying to broadly disseminate the self-directed Walk with Ease and really needed to develop some tools to help us automate the process. So that was kind of the impetus behind the development of it. We also and some of our partners also have multiple kind of co-partnering organizations, so it's very helpful in that kind of situation. And also, if your audience does not want to attend or is not able to attend in-person workshops, we really were trying to develop something to help all those different instances. So the system allows kind of two areas of focus, program administrative features and then participant features as well. So the program administrators are able to capture pre and post survey data, enroll people in the program, deliver the print books or ebooks, set up custom pages, send tailored weekly emails and text messages, utilize an internal messaging system, assign coaches and registrars to participants or groups of participants, and just kind of overall help manage the program and then also motivate participants to adhere to the program. And then the participants also get benefits from the system. It allows them to create a secure portal that they can log into and access through a mobile device, their phone, laptop, computer, etc. And it provides tools and resources that enhance the program and also enhance adherence to complete the program. So they can use the system to set goals, track their walking, view videos, listen to audio lecturettes, download resources, print off a certificate of completion, and generally just see their progress through a visual graph that we have on the portal. So I just wanted to show you this. This is just a quick snapshot of what it looks like in the participant side of things. I know it's very hard to see on this slide, but you can see that there's a video on the right-hand side. There's that graph below it that I was mentioning. There's a tab for each week of the program. They can read the book in the portal. They can set their goals and then they can track their walking either in the portal itself or via a feature that we call text to log. So they can text their minutes of walking and the system will actually save it and apply it to their portal. They can also restart the program if they want to take the program again. And then we also have a what we call a maintenance section called Keep Walking. So if they find this is a helpful behavior change support, they can continue to use the key features of it. So this is the URL you can go to learn more information. We have many details that we can provide for you if this is something that you might be interested in learning more about. And I'm happy to get on the line with you and do a full demonstration. And this is my email address. I'll go ahead and kick it back to Kirsten.
Thank you so much, Serena. Next, we will hear from Kailyn Horn, a physical therapist and third-year PhD student working with Dr. Christine Pellegrini in her Technology and Behavioral Intervention Lab at the University of South Carolina. Kailyn serves as a coordinator and health coach in Dr. Pellegrini's lab, and her research interests center around balance, function, and quality of life in older adults. Kailyn will tell us about the telephone delivery format of Walk with Ease.
Thanks so much, Kirsten. All right, so I'll briefly chat through the telephone delivery adaptation of Walk with Ease. So this is a 6-week program. So it's partnered with the South Carolina Department of Health and Environmental Control. And some of the resources we use the Walk with Ease guidebook for a large portion of this program. So let me talk through kind of start to finish what this program looks like. So we start just by giving them a program overview over the phone, and we mail the Walk with Ease book to them. And then the program is led by a certified Walk with Ease leader who has completed the Arthritis Foundation's Walk with Ease program leader training, but then also a supplemental telephone delivery training specifically for this program. So it is a cohort-based program. Each cohort consists of anywhere between 5 to 17 people. And we have the same leader that facilitates group calls and individual calls through the entire program for each cohort. So the group calls are usually between 45 to 60 minutes, and they focus on education relating to exercising with arthritis. And then the individual calls are usually between 10 to 15 minutes. And they're really about tailoring the program to the individual and setting weekly walking goals. Generally, we're shooting for 30 minutes a day for 3 to 5 days a week as the goal, but that's definitely adapted in those individual calls depending on what the participant needs. So overall, we found that there was good engagement, adherence, and retention, which I think is always the question when it comes to telephone delivery. Is it going to be, are we going to have good retention and good adherence to those calls? But we found that we had 93% retention at the end of the 6-week program, and participants completed an average of 4.5 out of 6 group calls and 5.3 out of 6 individual calls. So really good engagement in the program. We found that it was effective on our major outcomes, and about 93% of participants reported that they were well satisfied with it. So in conclusion, we think that this remotely delivered adaptation shows really good promise as an effective alternative for adults with arthritis who face barriers to in-person programs.
Wonderful. Thank you so much, Kailyn. I am going to now move us into a brief testimonial. We really wanted to provide an opportunity to highlight an example of a partner agency that is working to expand AABI options. And so it's my pleasure to introduce our colleague, Erin McHenry Wolf. She is the Arthritis Program Coordinator at the Minnesota Department of Health. Erin has a background in health communication and previously worked on COVID-19, oral health, diabetes, and health behavior messaging, in addition to current work supporting physical activity strategies to support arthritis, aging, and chronic disease management and prevention. So welcome so much, Erin.
Thank you. All right, I will try to go quick here and not bore anyone. So in Minnesota, we have over 10 AABIs that we currently offer, such as Walk with Ease, Tai Chi Quan, Moving for Better Balance, the Chronic Disease Self-Management Program, and others. In 2025, we had 2,541 participants, though we know this is an undercount because we know of some programs that are happening, but we don't necessarily get their data. In 2024, we had more than 3,400 participants. And this map here on the side, I'll put a link to this in the chat. This was something that our evaluator did that just kind of is a nice depiction of sort of where we're seeing the programs and how that relates to some of the disease areas. So to deliver ABBYs, you really need to rely on partners. I've listed here some key partners. A big one is the area agencies on aging. One of the reasons that they can be a really great resource, besides just being a key part of supporting aging networks, is that they can use the Title 3D funds to sustain their programs. That's funding through the Older Americans Act. And ABBYs are so important for arthritis management, but they also can be really valuable for things like dementia risk reduction, falls prevention, and social connection. Community-based organizations are really helpful and can provide adaptations to make sure that they meet community needs. We also work with cooperative extension at the University of Minnesota. And then I would also say local public health and clinical professionals and clinics or healthcare partners can also be key for delivering ABBYs, whether that's just being a referral partner or if they are actually offering the programs themselves. Local public health sometimes can also think about how to integrate the ABBYs into like policy systems and environmental change projects. So, for example, if they're doing a safe routes initiative and making walking trail upgrades, they could pair walk with ease with that as well. And, Serena talked about the Osteoarthritis Action Alliance portal. That's a program that we support as well. That's a really great one with healthcare partners that they can refer patients to quite easily. Okay, so I'm going to talk briefly about a couple projects that we have. The first one I'm going to talk about is called Stroke Inspire. We offered Walk with Ease for participants in a stroke recovery support group, which was really helpful as it provides some flexibility on participant activity levels, and there were adaptations for disability. So even though these weren't necessarily just arthritis patients, it was really helpful. And they actually did a Walk with Ease self-directed enhanced model that Nick talked about, where they had 1 to 2 group walks in the week, and then they completed the other walks individually, which helped encourage self-efficacy and learning how to do this work back home. The next one is a project with a clinical partner, TRIA. They are the orthopedics branch of a large health system in the Minneapolis-St. Paul metro area. They've created a comprehensive care model for arthritis patients where they're screened for physical activity and they meet with a physical therapist, orthopedics, and really integrate physical activity throughout. So one of the ways that they might kind of be prescribed physical activity is participation in an ABBY. So that could be out directly to the community through the Juniper network, which is a network that offers multiple ABBYs. They also actually happen to be an area agency on aging as well. Or they could be referred to a ABBY that is actually offered on site at the clinic. They are offering the Arthritis Foundation exercise program. And one thing that's kind of nice about that is that for the patients, it feels a little less daunting. They know where the clinic is, they know where it's at. And they've created some just kind of systems between the partners to Juniper and Tria to have some bi-directional communication between the care team and the ABBY coach to help monitor progress. I'll just share a couple outcomes from that one. Over for their first cohort, and so this is for their whole care model, so not just exclusive to the ABBY, but they found that their participants had an improvement equivalent to a total knee replacement. And 69% of the people in the first cohort achieved what they called minimally clinically important difference, which means that they say that they can see a change in their daily life. And then just a couple things, we talk about the research, but sometimes it's really great to hear the patient testimonials. So some feedback they received, someone said that they felt capable enough to play in their annual family Thanksgiving football game. Another person shared that they were able to climb up and down a ladder to paint their living room, which they didn't think they'd be able to do previously due to their arthritis pain. And I think I'm just going to skip my my last one because I'm a little over time. So future opportunities, I think there's a lot of opportunities where you could think about insurance reimbursement. AABIs could be a referral resource clinics could use for integrating physical activity and nutrition assessment codes that just came out in the CMS provider guide. Or think about we're considering training CHWs as leaders and then using CHW billing codes to support that. There's been some success with some of our partners coupling AABIs like Walk with Ease with something like the diabetes prevention program. And then lastly, we have some work with Centers for Independent Living, and we could think about how we might be able to integrate AABIs into their independent living skills training as that aligns with ACL goals and funding. That was really quick. I hope it was helpful. If anyone has any questions, I'm happy to share more. Thanks.
Thank you so much, Erin. That really was wonderful. You're doing such good work in Minnesota, and I'm sorry we couldn't give you more time to showcase all of your work and your partnerships. And thank you to Nick and Kailyn for joining us as well. We're just going to wrap up here. I want to mention that we have updated our website with information about the new AABI standards and review process. The letter of intent is available there. I just dropped into the chat the link to the website. It's also listed there. If you have questions about the standards or anything we discussed today, hope you'll check out that website. You can also use the second URL on the slide. I dropped it in the chat, or this QR code to submit any questions you have through a Google form, and we will respond to those questions and send out the answers to everyone who registered. I'm just going to launch a poll here. And if you have time, please take that before you leave. In the meantime, I hope you can join us for our next Lunch and Learn on July 15th at 12 Eastern Time, Implementation and Outcomes of a Lifestyle Medicine Program for People with Musculoskeletal Conditions. I put the link to the registration in the chat. That's all we have for you today. Thank you so much for joining us, and I hope you have a great rest of your day.